Welcome to our channel. Today we are about to delve into an extremely important topic, bowel cancer. It is crucial that you subscribe and follow this video closely as we are about to discuss the key symptoms of this disease and its importance in early detection. Bowel cancer is a condition that affects millions of people around the world, and early detection is key to successful treatment. Understanding warning signs such as changes in bowel habits, rectal bleeding, abdominal pain, fatigue, unexplained weight loss, abdominal bloating, and anemia can make a difference in someone's life. So stay with us for vital information and learn why awareness about this topic is critical for your health and that of your loved ones. What is bowel cancer? Bowel cancer, also known as colorectal cancer, is a malignancy that originates in the colon or rectum, crucial parts of the digestive system. This cancer often starts as polyps, non-cancerous growths on the inner lining of these organs, which can become cancerous over time. It is one of the most common forms of cancer, affecting men and women around the world. Risk factors include advanced age, family history, high-fat, low-fiber diet, excessive alcohol consumption, and smoking. Early detection is essential for a successful treatment, and screening tests such as colonoscopy are recommended, especially for at-risk individuals. Treatment involves surgery, chemotherapy, and radiotherapy. Depending on the stage of the disease and the prospect of recovery is better when cancer is diagnosed early. Therefore, awareness, screening, and a healthy lifestyle play crucial roles in preventing and fighting bowel cancer. You already know what it is and how it is treated. Let's discover its symptoms together to prevent possible cancer. 1. Changes in intestinal habit. Changes in bowel habits are a warning symptom for several health conditions, including bowel cancer. This involves significant changes in the frequency and consistency of bowel movements. For example, the persistence of unexplained diarrhea or prolonged constipation may indicate problems with the gastrointestinal tract. Additionally, narrow ribbon-like stools known as thin stools can be a worrying sign. Any notable change in your bowel movement pattern, especially when accompanied by other symptoms such as rectal bleeding, abdominal pain, or unexplained weight loss, should be discussed with a healthcare professional. These signs can help in the early detection of bowel cancer, which, when treated in the early stages, is more likely to result in successful treatment and improve the patient's quality of life. Therefore, paying attention to these changes is essential to take care of your intestinal and general health. 2. Rectal bleeding. Rectal bleeding is an alarming symptom that can indicate several medical conditions, one of the most concerning being bowel cancer. This bleeding can manifest as the presence of bright red blood in the stool or as dark, tarry stools known as melena. It is crucial to understand that rectal bleeding should not be ignored, as it could be a sign of injuries or tumors in the colon or rectum. Although not all rectal bleeding is caused by cancer, it is important to seek immediate medical advice when detecting any bleeding in this region, especially if accompanied by other symptoms such as abdominal pain, changes in bowel habits, or unexplained weight loss. Early detection and adequate diagnosis are essential to ensure effective treatment and increase the chances of recovery. Therefore, any rectal bleeding should be taken seriously and discussed with a healthcare professional. 3. Persistent abdominal pain. Persistent abdominal pain is a concerning symptom that can indicate several medical conditions, including gastrointestinal problems such as bowel cancer. This pain, often described as cramping, discomfort, or a feeling of fullness, can occur in different regions of the abdomen. It is essential to pay attention to the persistence and intensity of this pain, especially if it is accompanied by other symptoms such as changes in bowel habits, rectal bleeding, unexplained fatigue, or unexplained weight loss. Although abdominal pain can be caused by various reasons, it should not be ignored, and it is advisable to see a doctor for proper evaluation and diagnosis. Early detection of bowel cancer can lead to more effective treatment and better prospects for recovery, making medical investigation essential when this symptom persists. 4. Fatigue and weakness. Persistent fatigue and weakness are symptoms that can be indicative of several medical conditions, including bowel cancer. These feelings of extreme tiredness and lack of energy can be attributed to anemia, which is common in colorectal cancer patients due to possible internal bleeding. Anemia results in decreased hemoglobin levels in the blood, causing fatigue, paleness, and weakness. It's important to watch for these symptoms, especially if they're accompanied by other gastrointestinal concerns, such as changes in bowel habits or persistent abdominal pain. If fatigue persists, it is advisable to consult a doctor for proper evaluation, diagnosis, and treatment. Detecting and treating anemia related to bowel cancer is essential to improving the patient's quality of life and recovery prospects. Therefore, any unexplained fatigue and weakness should be discussed with a healthcare professional. 5. Involuntary weight loss. Unplanned and unexplained weight loss is a symptom that can indicate several medical conditions, including bowel cancer. When the body loses weight significantly without a change in diet or physical activity level, it can be concerning. In the context of colorectal cancer, weight loss is often associated with other symptoms, such as changes in bowel habits, rectal bleeding, abdominal pain, or fatigue. It's important not to ignore unexplained weight loss and seek medical advice, as it could be a sign that something is wrong in the body. Early detection of bowel cancer is crucial for effective treatment, and unexplained weight loss may be one of the indicators of this health problem. Therefore, if you experience significant and unintentional weight loss, it is advisable to consult a doctor for proper evaluation and investigation. 6. Abdominal bloating. Persistent abdominal bloating is a symptom that deserves attention as it can be indicative of several medical conditions, including bowel cancer. This bloating, also known as bloating, occurs when the abdomen appears larger than normal and may be accompanied by feelings of fullness, gas, and discomfort. In the context of colorectal cancer, abdominal swelling is often related to other symptoms, such as changes in bowel habits, rectal bleeding, abdominal pain, or fatigue. It is essential not to ignore persistent bloating and seek medical advice, as it may be a sign that something is affecting the gastrointestinal tract. Early detection of bowel cancer is essential for successful treatment, and abdominal bloating can be an important indicator of this health problem. Therefore, if you are experiencing persistent abdominal bloating, it is advisable to seek medical evaluation for proper diagnosis and treatment. 7. Anemia. Anemia is a medical condition characterized by a reduction in hemoglobin levels in the blood and may be related to several causes, including bowel cancer. When colorectal cancer causes bleeding in the gastrointestinal tract, it can lead to blood loss not visible to the naked eye, resulting in anemia. Typical symptoms of anemia include fatigue, paleness, weakness, and lack of energy. It's important to note that anemia is not specific to bowel cancer, but it can be a warning sign when accompanied by other gastrointestinal symptoms, such as changes in bowel habits, rectal bleeding, or abdominal pain. Therefore, if you experience symptoms of anemia, it is advisable to consult a doctor to investigate the underlying cause, including the possibility of bowel cancer, and begin appropriate treatment to restore healthy hemoglobin levels in your blood. Early detection of bowel cancer is crucial for effective treatment, making it important to seek medical help when faced with these signs. In conclusion, awareness of bowel cancer symptoms, such as changes in bowel habits, rectal bleeding, abdominal pain, fatigue, unexplained weight loss, abdominal bloating, and anemia is critical for early detection and effective treatment of this illness. While these signs can indicate a number of medical conditions, including ones other than bowel cancer, the importance of seeking medical advice cannot be underestimated. Each individual is unique, and only a doctor can perform individualized assessments to determine the precise cause of symptoms and develop an appropriate treatment plan. Early detection greatly increases the chances of recovery, making it crucial that any concerns are discussed with a healthcare professional. Therefore, when identifying any of these symptoms, do not hesitate to seek medical help to ensure the best approach for your health and well-being. Thank you for watching this video and giving your time to raising awareness about bowel cancer. Sharing this content can save lives by helping more people recognize symptoms early. Don't hesitate to share this video with friends and family so everyone can be informed and vigilant. And don't forget to watch the next recommended video on screen, where we will continue to bring you valuable information about health and well-being. Thank you for being part of our community.